Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Monday's Q&As. This is where I answer your direct and specific questions as long as they can be generalized to everybody else. So if you do have a question for me, email it info@drzphd.com. The email is down below. If I feel like I can't answer your question, which for some of you has been the case, I will go ahead and just email back and let you know that it is not something that can be generalized. So please don't hesitate to send your questions to me. As always, I have selected a random 6 questions in appearance that they come to me in a Q&A folder. I have blocked out everybody's name for privacy's sake, and I'm including the timestamps below so that way you can jump around the topics that is of interest to you. Having said that, I'm excited to dive in and see what kind of questions we have selected today. Sometimes it's interesting how it works out, but whatever I randomly select, there seems to be a unifying theme, so it's always interesting to see that. So having said that, let's get started. Question 1, first question for the day. Hi, Dr. Z. I haven't talked to anyone other except on social media, with exception to one therapist, about me, and it's very affirming that I'm not alone and that there are so many with my same experience. I'm interested in going to therapy and have identified a few who have experience in gender issues or many follow W path. My experience with the therapist was a little off-putting, as also she meant well, seemed to be more of a conversation with her, quick to think I was trans, as opposed to analyzing and assessing my thoughts. It wasn't what I was expecting. Question: What should one interested in therapy expect from an initial consultation and initial therapy session? Would appreciate you addressing this type in Q&A, a video or a short, or if you already have my apologies. You have so much amazing content that makes all of us feel normal, and it's appreciated. Well, first of all of you are normal. But I don't think I have addressed it. This is a really, really, really good question, and I'd be happy to discuss it here on Q&A. So first, I cannot stress enough that even if therapists say that they're gender therapists and they are members of WPATH, it does not make them necessarily incredibly knowledgeable in gender issues. A lot of therapists today will put gender or transgender issues underneath a long list of other things that they tend to work with. It doesn't mean that they're solely focused or very specialized in it. It could be that they only had one trans client. It could be that they never had trans client and you're the first trans client that they see. Being a WPATH member doesn't mean anything. Anybody can be WPATH member. I'm a WPATH member. You just pay big membership fees, and that's pretty much it. It doesn't mean that you have finished any kind of WPATH coursework or any kind of WPATH seminars that they put out, or it doesn't even mean that you even read the research publications that they send out to WPATH members. Having said that, there's also a lot of people who do list that they focus on gender issues who are incredibly good at it. So I just want to point out, because I heard over the years, a lot of people say that they went to somebody who said they're gender therapist, and then they felt like they had to educate them and explain all sorts of vocabulary. It's also for somebody who is really, I would say, has a lot of experience or very specialized. It can be as quick as one session to confirm that it is gender dysphoria stemming from gender identity root issue. I have done this millions of times. The difference, and I want to be very careful here, the difference is you want to be careful not to have a therapist that has not really asked you any questions or probed, but just validated how you think about yourself, right? So affirming is important, but you also want somebody that is going to ask you questions and help you figure things out. When I conclude in a course of, say, one session that it is gender dysphoria, I ask a lot, I dive really deep, I ask a lot of questions. I go back to the childhood, I ask questions not only about the relationship to gender, but also the relationship to their sexuality. I ask questions about any kind of cross-dressing, either feminizing, masculizing behavior, any gender-bending behavior, relationship to gender. I ask a lot of questions. So anybody who ever been with me to therapist knows that I dive deep. And when I do come to conclusion that dysphoria stems from a gender root issue, I will also explain my thinking process. So you're not walking away, just taking my word for it. Having said that, I have also had a single session diving really deep with a client where it was also clear that it's not, at least with what they present to me right now, it's not very inconclusive. And I will also let them that right now it's very inconclusive, or something else is going on. I will also tell people that. So I don't want, when therapists are able to conclude things in the first session, it's not necessarily good or bad. It all relative to their level of expertise and to their level of experience, and also how that session has been conducted. Like I said, anybody who ever worked with me knows I'm very direct, and I'm also very interactive. I ask a lot of questions. I talk to you throughout the whole process. I'm not a therapist who sits back and listens to you for 15 minutes and just goes, aha, aha, aha. And how did that feel? And then says, yeah, that sounds like you're trans. That's not something that I do. I'm not saying that that's a bad thing to do. It's just not how I work. So keep that in mind. It's all situated within the context, how much experience I had, and can actually walk you through the process of determining that for you. A lot of people I work with, because they're adults, they come to me, they have such conclusive, they have decades and decades of history of dysphoria that you just, that speaks for itself, that kind of screams with big blinking green lights that yes, there's a gender dysphoria issue. Now, some of the things to look out for at initial consultation will be, again, how deep are they able to dive, the questions they're going to ask, all of that is going to tell you their knowledge base. And also, as I said, if they are coming to conclusion that it is gender dysphoria, can they back it up? How do they explain? Can they explain their rationale in other terms? Or are they just being affirming? I'm not a fan of just people who are being affirming. I know that a lot of people feel that it is a sense of identity that is subjective, and that is very true. But our subjectivity can get murky with a lot of other things. And for some people, it does get murky, and it's a clinician's job to help you discern through that process. Another thing that you want to watch out when you having an initial consultation with a therapist, apart from the knowledge base, you want to watch out whether they're able to, I would say, kind of not afraid to dive deeper with you, as well as they also have that knowledge base to understand different things, such as, for example, how body dysmorphia might play into it, how, for example, secondary, if you're struggling with secondary mental health conditions that you're already aware of, how they may play and affect things. Are they able to pick up on other elements that you're struggling with? Are they able to pick up on elements of anxiety present or depression present? Are they able to see how maybe other things, for example, some people I've worked with are common. They feel like maybe they're trans, although they feel very good about themselves, very good about their gender assigned at birth. But they have a history of feminizing, and it's history of feminizing that's solely always tied to sexual arousal and sexual orgasm. And they kind of wondering, could I be trans? Although feeling completely comfortable and good with their body. That's it. So in other words, you want to look out for clinicians that can see all of these nuances versus just thinking body incongruency automatically equals transgender. So yeah, that's what I recommend. This is a really good question, because ever since transgender issues kind of reached tipping point, there has been a lot of providers, like always out there in the world, the jump on the bandwagon in order to get the clientele. This is just the way the nasty world of business operates, and not all of them are skilled or knowledgeable or have enough experience. And usually you'll be able to tell if you has been a regular viewer on my channel and have heard me talk about these issues. A provider that says they're gender specialist needs to be able to articulate these issues in the same way. A provider that says they are at least knowledgeable in gender issues should be able to have vocabulary and articulate some of these concepts. And if they can't, and if you're there trying to explain what non-binary identity is, that's a huge red flag. So yeah, best of luck to you, and to everybody else looking for therapists. And feel free to anybody else share below what were your red flags that you learned working with people who claim to be knowledgeable in gender issues but turn out not to be. Question number 2. Hi, Dr. Z. Your channel has been a literal lifeline for me, so I cannot thank you enough for the work that you do. You are also welcome. No need to thank you. This is it's my life's hardest work. I really enjoyed. I am assigned male at birth 29, have come to terms with the fact that I'm transgender, and have taken the first steps of my social transition. So it has made a positive impact on my life so far. I do have a question that has been bugging me a lot. You see, a few months before I started questioning my gender assigned at birth, I was diagnosed with severe depression, mainly due to loneliness and social isolation. When my depression hit an all-time low and I was forced to reflect on some of my darkest emotions, I discovered that much of what I have been feeling throughout my past was actually gender dysphoria. I found out I was actually transgender, and the depression could possibly be a result of my gender dysphoria. It finally all made sense. By the way, it's incredibly common for depression to stem from gender dysphoria, and sometimes clinicians, going back to that inexperience, will sometimes think that it's all depression, and they will neglect spotting or working on gender dysphoria, only trying to fix depression with antidepressants, and not understanding why the client is not bouncing back or not doing well, because it's not it's a different, it stems from a different root causes versus chemical imbalance. It's induced by dysphoria. Studying transitioning has brought a lot of gender euphoria and excitement. It helped me get back on my feet and focus on living as my true self. I'm so glad to hear. However, I can feel my depression is still there, lurking and not yet dealt with. So I sometimes wonder if my questioning my gender is just a coping mechanism my brain created to cover up other mental distress. Even through the transition helps alleviate a lot of gender dysphoria. I'm starting to doubt whether the depression and dysphoria are really linked, or if I just wrongly assumed that, and I'm doing more damage because I don't address the right problem. This is a great question, by the way. What is your advice for people who are questioning their gender when there are other mental issues at play? Would it be better to deal with this problem separately, even if they are maybe related? This is a great question. So the question is, in this case, had been diagnosed with depression, and then started questioning their gender, realized they have dysphoria, started to do something about their gender dysphoria. Dysphoria got lifted, they feel better, but depression is still bad. And now they're wondering if the two linked, the two are separate issues, or if potentially the brain is making up dysphoria as a coping way with depression. And a bigger question, how to, what advice for people who question their gender when there's other issues present. So first, let's start with this. Advice for people who are questioning their gender when other mental issues present. When other mental issues present, or when you suspect something else is present, anxiety, depression, mood disorders, personality disorders, any kind of traumatic history, when anything you think or already know is present, the first things that I recommend is seeking out a clinician that can help separate, that can help, in other words, see whether those two are individual or whether they are linked. Returning back to this individual case, right? So individual felt depression, then thought the depression was byproduct of dysphoria. They started doing something about dysphoria, and the dysphoria lifted, but the depression remains. In this case, if I were working with this person, I would venture to analyze whether the potential actually two separate issues that a person thought that were one and the same. Another thing that I would encourage this person to do, if you're listening to this, what I really encourage for you to do is, if you, and I hope you are in therapy, because this is going to be very, very helpful for you, in therapy, parallel to now considering that they are two separate issues, which will mean for your provider to start helping you treat depression, then to also focus to what extent actually dysphoria is present, because you're questioning it, you're wondering if your mind made it up. I have yet to see a mind make up in 29-year-old a mind make up dysphoria in order to deal with depression, I have yet to see. But if you want more conclusive answers, that's what you want to look at. And you want to really have provider dive deep into your relationship with your gender, in your relationship with that, and how that all plays out. And when you say you have dysphoria, what does it alludes to? Let's not forget that one of the most important things is that when you started some elements of gender transition, social transition, your dysphoria lifted and you started to feel much better about yourself. And I think you mentioned you started to feel more confident. Um, uh, Here you go. It helped you get back. It helped me get back on my feet and focus on living as my true self. So those are all important elements. If this was your brain masking it in order to cope with depression, why are you feeling so much better? I know that if my brain were masking, hypothetically speaking, with dysphoria, social transition would not make me feel better because it would be incongruency to actually who I am and who I am. So the more I talk about it, the more it actually sounds like potentially it could be depression and dysphoria as standalone issues in your case. But this is definitely something that you need to work with clinician with in order to come to a more full, definitive conclusion. And it could also be that it is a byproduct of actually still byproduct of your dysphoria, by the way, but that the clinician you may be working with has not really excavated deep enough into where it's stemming from, what is it causing, and it could be collective, could be societal, it could be due to political climate, it could be so many other things. But this is a really, really good question. So hopefully that helps. Question number 3. Hello, Dr. Z. First, thank you for all the wonderful content you create. You are very, very welcome. The situation is this. I'm a non-binary individual in my mid-20s. I have finally accepted that I'm transgender and have loved every step that I have taken to transition so far. I have a dilemma. I'm out to everyone in my life except my parents. They would not be accepting and are very mean, spirited, and bigoted in other ways too. So I don't feel the need to have a strong relationship with them. I'm really sorry to hear that. So the problem is this. I'm financially independent from them, but I'm worried that they might see my gender neutral name change on official documents like bank transfers because they agreed to help me cover a part of grad school. That's amazing. That's, I seldom hear parents who are able to do it these days. I had to take out ridiculous. I'm not even going to go there. How much the loan was. I don't want to hold off on my name change, but I'm worried about their eventual negative reaction. Any advice for managing unsupportive relationships when transitioning would be greatly appreciated. Yes, so I hear you. You feel torn. You're completely independent from your parents, but you also sounds like somewhat financially dependent for them covering your grad school expenses. And so it's one of those things where if they find out, you presume and feel that they may yank that support from underneath your feet. What do you do? How to navigate unsupportive relationships when transitioning would be great when you want to transition. Well, let's start with the fact that you're not being fully transparent with them, right? So if you want to have any kind of, if you want to work at repairing any kind of potential relationship with your parents, I would say honesty would be important, even if that honesty is at expense of them turning their back on you or them yanking the financials from underneath your feet. However, that is a very personal decision. And if you decide not to do that, that is a personal decision for you. I can't, I'm not going to, it's your life. I absolutely bear zero judgment, honestly, what you decide to do. On the other hand, you kind of, you can't, what is that phrase? You can have something and eat it too. Oh my God, I forgot. What is that American phrase? You can have something and eat it too. Big blank. In other words, you can't have both things at the same time. You can't continue with your transition and change your name and continue on that path, and at the same time have them support your grad school financially if you truly believe that they're going to yank the finances. Something is going to have to give. You won't be the first young adult who has to sacrifice, who has to give up that financial luxury of them paying for grad school in order to root yourself in your truth and your authenticity, in order to go forward with what feels important to you. But it's still a personal decision. I've known many adults who, young adults, I know many older adults who felt like that their parents are older, and if they were to come out, they would be left out of inheritance. I've heard all of it. And people waited until their mothers, their grandmothers would pass away before they started living their lives. And people waited until they finished and graduated colleges and they came out. That's a personal decision. Again, zero judgment on whatever you decide. Just whatever you decide goes into the decision with a very honest understanding that what you're bargaining with, the bargaining chip in that case, is your well-being, and you're prolonging living with dysphoria for yourself. That's a bargaining chip. And if you're okay with it, that's fine. If you're not okay with it, then the bargaining chip in this case becomes that financial support. But it's a personal decision. You know, who knows? Maybe your parents will really admire that you're kind of standing up for yourself. I don't know. I really don't know what your parents are like. I don't know. You know, sometimes, God, I mean, the grad school loans are also burdensome. So again, lots of things to wait, but just sit down and really do the pros and cons and just be very open and honest with yourself with what you're bargaining and what you're giving up either way, and be okay with whatever you decide. Okay, whatever you decide, make peace with it and move forward. And I wish you all the best. Question number 4. Hello, Dr. Z. I have some questions you may want to consider for your Q&A. I have accepted I am trans male to female. What I struggle with is understanding what exactly it is that makes me trans. When I pose that question, I come up with 2 answers. I'm trans because I want to be a woman is the first. The second is I'm trans because I identify as a woman. For me, the first answer is clear. As long as I remember I wanted to be a girl and imagined what it would be like to dress and live as one, my identity as a woman is more difficult. I surely do not identify as a man. I do feel as if I am a woman quite often, but it is not constant. The times it does not occur um, to me, I'm not thinking much about gender at all. During those times, I'm usually occupied with some activity. I must say that as my transition continues, my identity as a woman grows stronger. Dr. Z, can you put into perspective these 2 things, desire to be gender different than the one assigned at birth and identification with a gender other than your birth gender? I would like to transition. I would think to transition, desire has to be there, but what about identification? Can we trust that if we follow our desires, identification will follow? This is another, I love this question for today. This is another such a good question. How do you, how important are desire and identification? What happens if you have one or you don't have another? In my experience, it is usually the desire for majority of the people that comes first. Identification follows, and in a lot of cases, identification in the beginning for a lot of people I noticed tends to be there, but it's very surfacey. What I mean by surfacey, in order for us to identify with, in this case, in order for you to identify as a woman, desire is not going to be enough because you're going to need lived experiences as a woman. And until you start living those experiences in some shape or form, either acknowledging you're a woman, citing social transition, medical transition, surgical transition, unless you do those things, identification is going to continue to be surfacey. Identification and lived experience go hand in hand. You have to have those experiences in order to accumulate self-identification, okay? Very banal example. I had a desire in the beginning to be a psychologist because I love psychology. I love everything about it. That is desire. Did I identify as a psychologist? No, I did not identify as a psychologist, not even after I finished the grad school, not even after I completed clinical training, and I sat for licensure and passed all the exams and got my license that said psychologist, clinical psychologist. I still did not identify as a psychologist. It was surfacey. I knew I was a psychologist. I knew that was part of my identity, but I didn't become to really identify it on a deeper level until I started gaining the experience working as a psychologist and becoming more confident and affirmed in that role. The same thing. The same thing. So it's not that whether you can you trust to follow your desire? Absolutely. And identification will follow. For a lot of it, it does follow. It's very important. So yeah, this is such a great question. But yeah, identification is rooted in experiences. Desire is rooted on a deeper plane. It's almost like your soul. Desire to me is something that, the way I look at a true inner desire, it's almost as if all of us are born and we have this internal blueprint of what how our soul is supposed to unfold on this planet. I know, it might sound all like very spiritual voodoo to you and new age crap, but I really mean that you can find the word to describe it for yourself. And like for me, I strongly feel that my past truly was psychology and specifically this field, because for some reason I can't even fathom sometimes. I just get gender, like I just understand it, and I'm cis. So, in fact, I have people who work with me who assume that I'm trans, and then they'll say some things like, I had a client recently who said, "I'd love a voice therapist that you worked with," and I said, "I never worked with a voice therapist. I'm cis," because of how well I know these issues. So I feel like for me, this was my blueprint to do this. This is also why I create content, because I feel like not only it's my calling, but it's my responsibility to pass on the knowledge and information to all of you and to other providers. That is desire. A lot of you have the desire towards your authentic gender blueprint. And you have that for a reason, because that's who you are from the get-go. Identification is experiences. It's going to follow once you have more of those lived experiences. That is a really good question. Thank you for asking it. Anybody else chime below, share where, did you have a strong identification in the beginning? Did it come later with experiences? Are you still feel like you're accumulating that identification? Again, identification as a woman is going to be there, but it's going to be a little bit more surfacey, right? It's going to be like, I know I am a woman, the way like I knew I'm a psychologist, but real identify as psychologist for me came later, and for a lot of you will come later too. Great question. Question number 5. Dr. C, good night, and always thank you for taking your time to answer our questions. Believe me when I say that they're really useful. I really appreciate it. You're very welcome. My pleasure. My question is, I started hormones not long time ago, and I think everything is going well. My family accepts me and my friends are very nice to me. It seemed that after I got my first shot of spirolactone, that's the testosterone blocker. Well, it's not technically a blocker, but this is like later I'm saying it. My veil of denial faded away. Automatically, I started to feel more comfortable with the idea, more excited about the future, and many doubts went away. The problem is that after that shot, my dysphoria has increased as I had never felt it before. I mean, I know I had dysphoria since I was a kid, but I could live. I wonder if are you taking anything else other than spiral, or you're just taking spiral and nothing else? I've had dysphoria since I was a kid, but I could live with it. Now it's so painful that sometimes I don't even shower, because that means that I have to look at myself. Yeah, that's hard. I'm really sorry to hear that. Shave, I'm about to start laser and watch myself in the mirror, not being who I want. I'm 29 and I live with the fear that hormones will do nothing for me. So you are on hormones. Okay. I don't want to live my life slaved by dysphoria and waiting for changes to happen. So I feel better, because that isn't life. I'm trying to keep going and thinking, do you think this is normal? And it gets better with time. So this is first and foremost a great question for you endocrinologists, because this is a medical nature question. I will share some insights because I worked with a lot of people who, when they started hormones with Spiro, they also had an increase in dysphoria, and my observations on why that happens. But I really encourage for you to talk to your provider to see how you can tweak your regimen and to find the one that works for you. Now, it's not super uncommon that dysphoria may, and you actually said that after that first shot, you just denial went away automatically, you felt better, but then dysphoria kind of came back and it feels like it's not going away. It's not that uncommon for that to happen. In fact, I have a video, I believe, or a short video where I talk about why is it that starting hormones actually, your dysphoria went up versus going down. And sometimes people wonder, it makes no sense, shouldn't it go down? Well, not necessarily, because here's the thing. When you start gender transition, you're not just starting hormones. For a lot of you, you're also starting some social elements of that as well, which includes coming out, presentation, maybe some other elements, your pronouns, your name, and other things. And as a result, even though hormones are helping you alleviate distress, you now added additional stressors, especially right now in this climate that we're having right now. For a lot of people, it's additional stress. Oh, oof, reality. I'm doing this. Oof, reality. I have to come out at work. Oof, reality. I have to present this way. Oof, reality. I have to share, or I got misgendered. I have to inform the person of my preferred pronouns. All of the things will also increase your dysphoria because they increase your distress levels, and they also decrease your tolerance level to things. So while, yes, ideally it's supposed to lower things for you, you're also adding a lot of other things that are suddenly like, wow, I gotta do all of the things. Wow, this is overwhelming. And depending on the type of personality you are, and depending how you tend to cope with those things, is also going to be very, very telling. I have people who tend to deal with those things really well because they know they are on a path toward getting better. And as a result, it also helps decrease dysphoria. I see a lot of people that have catastrophic thinking. A lot of people that are also very prone to anxiety. And now they feel like, oh my God, I'm doing this and this should be the happiest moment in my life. But why do I feel like the whole world around me is about to fall apart? And oh shit, I'm feeling worse versus better. Your thinking will greatly influence also level and amount of dysphoria. So I'd be careful not to jump immediately that hormones are not working. I'd be very careful in assessing you and discussing with you how other environment and how things around you affect you. And most importantly, how you look at them. Most importantly, how you're coping with them. Most importantly, where you're at with them. I have some clients who I can just tell they're very, very anxious. They're just freaking out about everything and anything, even though they know this is what they're supposed to do. And as a result, they feel more dysphoria versus less, because they kind of bring it on themselves in a way due to all the state of induced anxiety. But this is a really good question. And first, check in with your medical provider, see what things can be tweaked. And then with your psychological provider, with your mental health provider, discuss all of the things. But this is common. It's not uncommon for dysphoria to go up as you start hormones while you think it should go down. Because again, remember, you bring in also these other things. You're doing things you've been afraid maybe to do for the longest time. Many of you have been really afraid to start transition for a lot of years. And now suddenly you're doing it. That's scary. That's terrifying. Even with the hormones and everything, that's still very, very scary. So that's what I would really recommend. Really good question. And I wish you all the best. Final question for the day, question 6. And this one is lengthy one, so bear with me as I read through this. And as you all know, stumble as I read through this. Hi, Dr. Z. I've been watching your videos for a while because I've been struggling with the gender questions quite a bit recently. Currently, I'm 32 years old, assigned male at birth, and I have desired a feminine body for as long as I can remember. It has always been the realm of fiction or daydreaming. I never gave my serious consideration at all to the idea that I could be trans until very recently so. I don't have stereotypical feminine interest. Also, I guess I'm not much of a masculine stereotype either. And I generally feel like my gender role as a man is okay outside of how I'd like to dress and what kind of body I'd prefer. Also, when it comes to dating, I've always been puzzled by the masculine approach to relationships and not had any interest in pursuing it that way. In 2019, I started playing a VR game called VR Chat, where you can use a custom avatar to represent yourself in virtual reality with full body tracking. At first, I felt ashamed for pretending female avatars and would search for male avatars all the time. But quickly, I found myself surrounded by other men who have used female avatars, and it became very normal. That's actually very common. I think I know where the question is going. Recently, um, recently, I become more and more distressed about gender. The occasional dissociative breakdown I have maybe once every couple years or once a year has become almost daily. That's, I gotta say, if you're having dissociation daily, that's 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 quite a bit of dissociation, to be honest. I'm not really distressed by my male body or male identity so much as by feelings that I would prefer to have been born with a female body. I would cope by cross dressing or shaving my body hair or something else in the past. And normally, I'll just move on with it and stop after my emotional state recovered. But lately, I've been cross dressing daily and shaving my body hair frequently and still having the same dissociative episode day after day. I've been contemplating medical transition recently, and I just can't seem to understand if that's the right for me. I'm simultaneously afraid that all my friends know I'm secretly trans, so I have to hide it. And also afraid that nobody will believe me that I'm trans, so I can't come out without proving it to myself and everyone else somehow. The contradictions are so frustrating. I feel like my brain is playing a game of 4D chess against itself, denying and invalidating every positive experience I have and twisting it into something else. One of my friends told me that the thought of using the female avatar in VR chat gave me the dysphoria, and I haven't been able to get those thoughts out of my head either. So maybe my biggest question is, could using a female avatar for so long have given me dysphoria? If I stop completely, I'm afraid it will just let me ignore the part of me for longer until it blows up even bigger later. Because I know exactly why I downloaded VR chat in the first place. I did it because I wanted to use female avatar. I wanted to have experience of a female body. My friend, you're answering your own questions as you go along, by the way. It just feels like I can be trans because I would have been more girly growing up. No, that's not true. And that now I must have just been infected by some kind of social contagion that did this to me. At age 32, I don't know, I have yet to see somebody at that age inflicted with social contagion, which is in of itself is questionable. But I can't figure out where to go forward from here if not transition. For a while, I thought I could be femboy, but being a feminine man without feminine body feels so wrong to me. I'd like to be a woman with all my interests and personality traits intact, and but this just feels like I must not actually be trans. I can't even begin to understand what it means to be a woman in society, and I can't really say I know much about being a man other than I've lived it and it's pretty normal. So being a woman would probably just be normal too, right? So I'm probably just overthinking that part of it. Anyway, sorry for the long-winded email, and I guess I don't have much of question in here. Any comments or anything would be appreciated, but I understand you must get hundreds of ramblings like this without much direction. I don't think you're rambling. I think you gave all of us a very clear direction, and I completely understand your dilemma and your struggle, and I can also hear your ruminating tendencies. Your mind tends to ruminate, my friend, which is not a bad thing, but just I'm pointing it out just so you can be aware of it. And ruminating minds can take something and just run with it and run with it and run with it. So, okay, I want to point out a few things. First of all, I want to point out, sorry, let me just turn this off. Okay, so let me reiterate what you consider rambling, which is not rambling at all. Can exposure to VR gender avatars for prolonged period of time cause gender dysphoria in adults? Two, for you specifically, how much of this is actually dysphoria, how much of this is not? I want to point out that you said that at age 32, um, you have desired the feminine body for as long as you can remember. So you're already telling all of us and to yourselves that you have an early childhood onset of feeling incongruent with your gender assigned at birth. That's really important. So your onset in childhood is there. What I'm trying to point out and piece things for you together is that it's not like you don't have that and suddenly you stumbled into VR and suddenly all of a sudden the dysphoria came up. So just pay attention to that. Number two, like I said, I have yet to see adult age 32 who suddenly developed dysphoria by engaging in VR gaming with avatar of other gender. I have friends who are huge into gaming, who interchange avatars all the time, who feel very comfortable with their gender assigned at birth. I do also know that gaming and being able to have an avatar of the genders that you feel like you desire has been a huge outlet to a lot of trans folks in being able to project yourself out there in such a way. And that has been really, really soothing to a lot of people. And a lot of people who are gamers know this, and so you can chime in below. You have answered a lot of equations here, by the way. This is what I recommend because of the rumination. I recommend just step back from all of this. Step back, sounds like you just need a clean slate and you need to go to square one. It will help you tremendously. Instead of rushing into things, rushing into transition, your clean slate will be move away from the gaming, stop gaming, right? Just see what's going to happen. See if you can find a local therapist and start exploring your relationship to your body. Start exploring your relationship to your body, what it means for you, where dysphoria pops up, what is it trying to tell you, what is it trying to communicate to you about yourself. Start doing all of that as a square one versus still gaming and feeling particular thing as a result of it, and then spend days when you're not gaming ruminating about it. That is not helpful to you, right? Also, having friends and friends saying that the gaming has created social condition is not really helpful in this case. So square one for anybody who has gotten meshed with a lot of other ideas is, again, just to go back to how old was I when I first experienced any kind of discomfort with my gender assigned at birth. What was the discomfort about? How much of that has actually to do with gender identity? Did that persisted or continued? How did I feel about changes that started happening during puberty? What is it about my gender assigned at birth that I feel okay now about? What is it about it that I don't feel okay about? What is it about a feminine genders that appeals to me? What about it that I identify with? Start asking yourself all those questions ideally with a therapist. And before you know it, you should arrive at a clear base, that is not modeled with anything else. You should have your answer, and you should then, from that clear base, understand further, be able to understand how Zen gaming has kind of led you to where it led you. That's what I would really, really recommend. Instead of dismissing everything as not valid or jumping in transition, thinking this is what you're out to do, just pull back a little bit, square one, explore with a therapist, and like clear out the cobwebs. Imagine that everything else is a cobwebs, and as a result, your mind is now jumping all over to left and right, left, right. Could it be this? Could it be that? Could it be this? I also hear a lot of fear in there, a lot of resistance, which is normal. It's for a lot of you, it's really scary to consider that some of you might be trans. It's a lot of people make a lot of very stupid, inaccurate statements that it's a choice, and trans people, they're just delusional and they jumping into this choice. The reality is that it's scary and terrifying, and most of you are afraid because that this is a big life-altering decisions. And if anything, it's the opposite of delusional. It's very prudent, it's very level-headed, and it's very kind of lucid decision making. So fear is normal and natural, but I really recommend for you to get to square one. And I hope this helps. It's a good question. Anybody who's been gaming knows that for a lot of trans folks, that has been very very healing and supportive in a way to create an avatar based on how they see themselves at the inside. And also, a lot of people who don't have any issues with gender have also played with interchangeable genders in avatars. Like I said, I know a lot of those friends, and it didn't mean anything to them. That's also important to think about. So hopefully this is helpful. Great group of questions. Thank you everybody who asked me those questions. Please email if you have any questions, info@drzphd.com. Don't be afraid if you like this person. Don't be afraid if you ramble. Don't be afraid. This is by the way not a ramble, but don't be afraid if you're not making yourself clear. I will always email back and say this is not clear, or I'm sorry, I can't answer it because it's too personal, or yes, I'll include it in Q&A. You have nothing to lose. And like I said, everything is always private and autonomous. So that way, and nothing is disclosed. And remember, whatever you're thinking, chances are somebody else is already thinking too. And this Q&As have been so helpful to so many people because the information pops up that they have never thought of asking. So comment below, and I will see you all next time. Bye.